Shravani Vishnu Butler, doing my second year post graduation at MIMS Vijayanagaram. Today,
ఏమైంది కనెక్ట్ అవ్వట్లేదు? పీపీటీ కనపట్లేదు. హలో హలో
హలో
ఓంకార్ ఏమైంది?
హలో సార్, అది సార్ నేను చూస్తున్నాను. నాది మీరు ఇందాక వచ్చింది సడన్ గా పోయింది. ఒక్క నిమిషం. హలో శ్రావణి,
హలో
hello sir. Sorry for the interruption, sir. 1 minute, sir.
హలో
is anybody able to hear?
yes sir.
Hello, sir. Sir, sorry for the
start,
interruption.
start.
Sir. Yes, sir. Good morning, everyone. I am Dr. Shravani Vishnu Butler, doing my second year post graduation at MIMS Vijayanagaram. Today, our topic of discussion is history of anesthesia, and moderator of our topic is Dr. Omkar, sir. So the brief overview of the lecture is to know what are all the anesthetic methods used before the discovery of either, to know about the different anesthetic principles, equipments, and their standards, the history of various anesthetic agents and adjuvants used, professionalism and practice of anesthesia. Though it's a little boring topic, I'll try to make it as interesting as possible. And the history of anesthesiology is a rich mosaic of interwoven events all around the world that have created and developed this specialty, right from the days of ancient Greeks and Romans to the computerized operating rooms of 21st century. So why should we need to study the history of anesthesia? Because firstly, the understanding of our past guides our future, and secondly, the history of surgery is also totally linked to the development of appropriate anesthetic techniques. So the history of surgery follows the history of anesthesia. During the Middle Ages, the Most common method used to achieve a relatively quiet surgical feat was simple restraint of the patient by force, but the patient used to have so much of agony. Anesthesiology is an amalgam of specialized techniques, equipment, drugs, and knowledge that, like the growth rings of a tree, have built upon over the time. Knowledge of the history of anesthesia enhances our appreciation of current practice and intimates where our specialty might be headed. Coming to the term anesthesia, it was coined and first proposed to use the term by Oliver Wendell Holmes in 1846. It is a Greek word in which an means without and aesthesis means sensation. Therefore, it implies without sensation. Terminologies varies within different countries. Like in North America, it spells as anesthesiology, whereas in United Kingdom, an extra is present. Briefly, the history of anesthesia can be divided into pre-1846, during which there is foundation of anesthesia. During 1840, between 1846 to 1900, there is establishment of anesthesia. During 20th century, there is consolidation of anesthesia. And during the 21st century, it is the future of anesthesia. Coming to the pre-1846 period, the Greek physician Dioscorides during the 1st century AD described the narcotic-like effects of the plant mandragora, in which its bark and leaves were used as a drug. It was the first. He was the first to use the term anesthesia to describe these effects. In 1721, the term was subsequently defined in an Universal Etymological English Dictionary by Bailey as a defect of sensation. 50 years later, in 1771, in the book Encyclopedia Britannica, it was described as privation of senses. In 1846, as we already discussed, Oliver Wendell Holmes was the first to propose the use of the term anesthesia to denote the state that incorporates amnesia, analgesia, and narcosis in order to make painless surgery possible. From the 9th to the 13th century, the soporific sponge, which induced drowsiness and sleep, which was also known as sleeping sponge, was made with mandrake leaves along with black nightshade poppies and other herbs, which were boiled and cooked onto a sponge, which was then reconstituted in hot water and placed under patient's nose prior to surgery. It was developed to provide pain relief during surgery. It includes the drug methods and non-drug methods in historic periods. Drug methods include the use of alcohol, opium, hyoscine, cannabis, and cocaine. And alcohol in excess was used to induce stupor and blunt the impact of pain. An interesting fact here is in Buddhist era, laparotomy was described using alcohol. And Sushruta used to perform plastic surgery of cut nose with the use of opium, Indian hemp, and wine to keep the patient sedated during the 2000 before Christ arena. Later, Hippocrates during the 500 before Christ described the relief of pain by the use of opium. Later, an English surgeon, Henry Hill Hickman, used high concentrations of carbon dioxide as an inhaled anesthetic to relieve pain in his patients. Coming to the non-drug methods, it included the use of cold, concussion injury, carotid compression, nerve compression, and hypnosis and mesmerism. So let us know about refrigeration anesthesia. During the Renaissance period in 17th century, local anesthesia in the form of application of cold water and ice was introduced, and Macro Aurelio described refrigeration anesthesia, which involved placing snow in parallel lines across the incisional plane such that the surgical field became insensitive within minutes, and it was extensively used during the Winter War period between Finland and Soviet Union in 1940s. Coming to nitrous oxide, it was first prepared by Joseph Priestley in 1773. He was an English clergyman and scientist. By heating, he produced nitrous oxide by heating ammonium nitrate in the presence of iron fillings. Humphrey Davy is an medical assistant to Thomas Beddoes at the Pneumatic Institution of Bristol. In 1798, during when the inflammation was troublesome, Humphrey Davy breathed 3 large doses of nitrous oxide, and the he observed that pain diminished after first 4 or 5 respirations. Therefore, he suggested nitrous oxide be used for painless surgical operations and named it laughing gas later. He published his work in his book Researches Chemical and Philosophical in 1799. In 1815, he invented the Davy's lamp. Uh, a quick note on Horace Wells of Hartford, Connecticut. He recognized what others had ignored, that is the analgesic potential of nitrous oxide. In 1845, Wells attempted a public demonstration in Boston at the Harvard Medical School, but the trial was judged a failure. Coming to ether, Valerius Cordus in 1540 synthesized ether and named it sweet oil of vitriol by distilling sulfuric acid, which is also known as oil of vitriol, with fortified wine. He used it for relief of whooping cough and other respiratory diseases. Frobenius is the scientist who named it ether, and Michael Faraday described the narcotic effects of ether. The first public demonstration of ether was done in 1846 by William Thomas Green Morton, who is known as father of surgical anesthesia. Morton, after anesthetizing a pet dog, he became confident of his skills and anesthetized patients in his dental office. This is a picture of first public demonstration of ether. It took place in Boston General Hospital on October 16, 1846, for the excision of a congenital vascular tumor on the left side of the jaw and neck in a patient by name Gilbert Abbott, by John Collins, professor of surgery at Harvard Medical School. This is the ether dome at Massachusetts General Hospital. Coming to the ether inhaler, a large glass bulb containing a sponge soaked with colored ether and a spout that was placed in the patient's mouth. An opening on the opposite side of the bulb allowed air to enter and be drawn over the ether soaked sponge with each breath in order to make the patient unconscious. Coming to chloroform, James Young Simpson was the first to use ether for relief of labor, but he's not very satisfied with it, and so he introduced the inhaled chloroform after a dinner party on November 4th, 1987, and he promptly fell unconscious. He first published this finding in The Lancet. John Snow used chloroform to deliver the last 2 children of Queen Victoria, and he administered analgesic dose of chloroform on a folded handkerchief. Um, and he developed anesthetic apparatus. His best known apparatus featured a unidirectional valve within a well-fitting mask of his own design, which closely resembles the form of modern face mask. The face piece was connected to a vaporizer by a breathing tube, which John Snow has deliberately designed to be wider than the human trachea so that more rapid respirations would not be impeded. This is called the chloroform inhaler. Over the years, he introduced the agent-specific chloroform inhaler also. This element of his work anticipated the modern concept of MAC, which is minimum molecular concentration, and he published 2 remarkable books on the inhalation of vapor of ether and on chloroform and other anesthetics in 1858. Next, Joseph Clover became the leading anesthetist of London after the death of John Snow in 1858. He anesthetized a patient with chloroform and air passing through a flexible tube from a clover bag. This is a picture of clover bag, and he was the first anesthetist to administer chloroform in known concentrations through the clover bag. After 1870, Clover favored nitrous oxide ether sequence. The portable anesthesia machines that he designed were in popular use for decades after his death. He was the first Englishman to urge the now universal practice of thrusting the patient's jaw forward to overcome the obstruction of the upper airway by the tongue. Coming to the tracheal intubation, the first tracheal tubes were developed for the resuscitation of drowning victims initially. In 1878, a Scottish surgeon, William McEwen, introduced these tracheal tubes. In between 1900 to 1912, the nasal and oral intubation techniques were introduced. And in 1919, a self-trained British anesthetist, Sir Ivan Magill, introduced the blind nasal intubation. In 1920, Magill's angulated forceps, he applied a cocaine to the nasal mucosa to facilitate awake blind nasal intubation. In 1926, Arthur Gödel introduced cuff tubes by dung dog demonstration. And in 1941, Robert Miller of San Antonio, Texas, Miller brought forward the slender straight blade with a slight curve near the tip to ease the passage of the tube through the larynx. Robert McIntosh of Oxford University, he introduced the McIntosh blade, which is placed in the vallicular rather than under the epiglottis, and it was invented as an incidental result during a tonsillectomy surgery. In 1953, single lumen tubes were supplanted by double lumen tubes, endobronchial tubes, by Robert Shaw of Manchester, England. David Sheridan introduced the centimeter markings along the side of tracheal tubes. In 1964, a Japanese physician, Shigeto Ikeda, developed the first fiber optic bronchoscope. In the 1980s, Dr. Archie Brain introduced the laryngeal mask airways. His Sir Archie Brain. Coming to the alternative circuits, in 1937, Phillips Oyer introduced a wall-less T-piece to reduce the efforts of breathing in neurosurgery patients. Gordon Jackson Rees improved the control of ventilation, substituting a breathing bag on outflow. And in 1972, Bain's apparatus was introduced. Coming to the ventilators, the history of mechanical positive pressure ventilation began with attempts to resuscitate victims of drowning. And the major stimulus to development of ventilators came as a consequence of devastating epidemic of poliomyelitis that struck Copenhagen, Denmark in 1952. Coming to the flow meters, in 1910, M. New had been the first to apply rotameters in anesthesia for the administration of nitrous oxide and oxygen, but his machine was not a commercial success. Rotameters designed for the use in German industry were first employed in Britain in 1937 by Richard Salt, but as World War II approached, the English were denied access to these sophisticated flow meters. After the World War II, rotameters became regularly employed in British anesthesia machines, although most American equipment still featured the non-rotating floats. The now universal practice of displaying gas flow in liters per minute was not a uniform part of all the American machines until more than a decade after the World War II. Coming to the vaporizers, it is a device which delivers a given concentration of volatile anesthetic agent. In 1952, Dr. Morris introduced the copper kettle at University of Wisconsin in response to Ralph Waters' plan to test chloroform by giving it in controlled concentrations. Morris passed a metered flow of oxygen through a vaporizer chamber that contained a sintered bronze disc to separate the oxygen into minute bubbles. The gas became fully saturated with anesthetic vapor as it percolated through the liquid. The concentration of the anesthetic inspired by the patient could be calculated by knowing the vapor pressure of the liquid anesthetic and the volume of the oxygen flowing through the liquid and the total volume of gases from all the sources entering the anesthesia circuit. This is a picture of it. Coming to the patient monitors, Joseph Clover was one of the first clinicians to routinely perform basic hemodynamic monitoring. Two American surgeons, George and Harvey Cushing, developed a strong interest in measuring blood pressure during anesthesia. The transition from manual to automated blood pressure devices first appeared in 1936. The first precordial stethoscope was believed to have been used by S. Griffith Davis at Johns Hopkins University. Albert Coatsmith of the Hospital for Sick Children, Toronto, fabricated his first esophageal stethoscope from urethral catheters and Penrose drains. Coming to ECG, clinical electrocardiography began with Willem Einthoven's application of string galvanometer in 1903. Within 2 decades, Thomas Louis and He had described its role in the diagnosis of disturbance of cardiac rhythm, while James Herrick and Harold Pardee first drew attention to the changes produced by myocardial ischemia. Coming to pulse oximetry, an American physiologist, Glenn Millikan, created an oxygen sensing monitor worn on the pilot's earlobe and coined the name oximeter to describe its action. Refinements of oximetry was done by a Japanese engineer, Tako Aogi, led to the development of pulse oximetry. In 1981, anesthesiologist William New and the two colleagues formed a new company called Nelcor, and they released their first pulse oximeter, Nelcor N100, in 1983. In 1954, Luft described the principle of infrared absorption by CO2, and he developed an apparatus for measurement, that is the application of capnography in anesthesia practice, and it was pioneered by Dr. Bob and Dr. Kalenda in the Netherlands. And breath-to-breath continuous monitoring and a waveform display of carbon dioxide levels helped the anesthesiologists recognize abnormalities in their metabolism, ventilation, and circulation. He's Dr. Sheshgirrao Mallampatti, who is a student and a professor at Andhra Medical College. He introduced the Mallampatti score to assess the ease of endotracheal intubation. Coming to the inhaled anesthetics, in 1540, Valerius Cordus synthesized diethyl ether. Paracelsus has discovered the analgesic effect of diethyl ether. In 1774, Priestley introduced nitrous oxide. In 1800, Davy has discovered the analgesic effect of nitrous oxide. In 1831, Dr. Vaughan introduced the chloroform, and in 1847, Simpson has discovered the analgesic effect of chloroform and nitrous oxide either with oxygen. In 1894, ethyl chloride was used by Swedish dentist named Carlson. In 1923, ethylene was introduced, that is trichloroethylene. The first attempt to prepare a fluorinated anesthetic was by Harold Booth and E. May in 1932. In 1947, Julius Shukis introduced the trifluoroethyl vinyl ether or fluoroxine, which became the first fluorinated anesthetic. This is a picture of Boyle's apparatus. In 1917, Dr. Henry Boyle used the nitrous oxide, oxygen, and ether anesthesia machine. The gases were routed through two perforated tubes in a glass mixing chamber containing water, which is known as the Boyle's apparatus. The halothane quickly grew in popularity later because it offered a non-explosive alternative to ether and cyclopropane. Boyle's machine was first invented by Henry Gaskin Boyle in 1917. Later in 1921, Waters to and fro absorption apparatus was introduced. In 1927, flow meter for carbon dioxide was included, and the volatile controls of the lever type and the familiar back bar made its first appearance. In 1930, the plunger of the vaporizer appeared in the 1930 model, and circle absorption system was introduced by Brian Swart. In 1933, dry bobbin flow meters were introduced. In 1952, the pin index safety system was introduced by Woodbridge, and in 1958, there is introduction of Bodoxil. Coming to the intravenous anesthetics, a firm understanding of the circulation along with adequate intravenous access was necessary before the use of drugs could be administered directly into the patient's bloodstream. And both of these aspects were firmly in place well before an appropriate IV anesthetic was devised. In 1909, a German, Ludwig, produced surgical anesthesia by intravenous injection of chloroform and ether. And 7 years later, Elizabeth of Switzerland reported the use of intravenous morphine and scopolamine. Those trials have failed, and the first barbiturate, barbitol, was synthesized in 1903 by Fischer and von Mering, and thiopentol was synthesized in 1932. It was the first clinically used. It was clinically used by John Lundy and Ralph Waters in 1934. And ketamine was synthesized in 1962 by Stevens and first used clinically by Corson and Domino in 1965, and it was released in the market in 1970. And etomidate was synthesized in 1964 and was released in 1972. The introduction of propofol was a major advance in outpatient anesthesia, which was released in 1980s. Coming to the muscle relaxants, the earliest clinical use of Curar in humans was to ameliorate the tortuous muscle spasms of infectious tetanus at that time. The earliest effective clinical application of Curar in medicine occurred in physiatry. Harold Griffith, the chief anesthetist of the Montreal Homeopathic Hospital, in 1942, Griffith and his resident Johnson anesthetized and intubated the trachea of a young man before injecting Curar early in the course of his appendectomy. Satisfactory abdominal relaxation was obtained and the surgery proceeded without any complications. In 1908, Hunt and Travo prepared succinylcholine among a series of choline esters, which they had injected into rabbits to observe their cardiac effects. This is a picture of a rabbit head drop assay in which Halliday of SPIP pharmaceutical company developed a method of standardizing dose of curare and D-tubocurarin in a normal rabbit. It had a point if it had a 0.1 ml of aqueous Curar solution injected every 15 seconds until it could no longer raise its head. Credits for the successful and safe introduction of Curar and D-tubocurarin into anesthesia must in part be given to the researcher named Holliday. Crude understandized the preparations of Curar produced uncertain clinical effects and undesirable side effects related to various impurities. Succinylcholine was prepared by Nobel laureate Daniel Bowe in 1949 and was in wide international use before historians noted the drug had been synthesized and tested long beforehand. These are all the events in development of muscle relaxant year-wise. Coming to the local anesthetics, the first local anesthetic introduced into medical practice, cocaine, was isolated from coca leaves by German chemist Albert Niemann and Lawson in 1960. The first clinical use of cocaine was in 1884, and it was by Sigmund Freud, who used it to wean a patient from morphine addiction. Freud and his colleague Karl Koller first noticed its anesthetic effect and introduced it to clinical ophthalmology as a topical ocular anesthetic. In 1898, Alfred Einhorn discovered the Nirvaquin, which is an irritant, so it was stopped using immediately. In 1900, Einhorn also introduced the first amino ester, benzocaine. In 1905, procaine was introduced. And in 1944, Lofgren and Lundquist introduced lignocaine. And in 1957, Akenstam introduced bupivacaine. In 1996, Ropivacaine was brought into light. The discovery of regional anesthesia, two main scientists were Karl Koller, who is an Austrian ophthalmologist, and Sigmund Freud, an Austrian neurologist. In 1884, Koller's friend Sigmund Freud became interested in the cerebral stimulating effects of cocaine and gave him a small sample in an envelope, which he placed in his pocket. When the envelope leaked, a few grains of cocaine stuck to Koller's finger, which he casually licked with his tongue, and it became numb later. At that moment, Koller realized that he had found the object of his search. He dashed to the laboratory and made a suspension of cocaine crystals. He and Gartner, a laboratory associate, observed its anesthetic effect onto the eyes of a frog, a rabbit, and a dog before they dropped the solution onto their own corneas. To their amazements, their eyes were insensitive to touch of pain. Coming to spinal anesthesia, the term spinal anesthesia was coined in 1885 by Corning, a neurologist who had observed the Hall and Halsted. Corning wanted to assess the action of cocaine as a specific therapy for neurological problems. In 1898, August Beer and Tuffier described authentic spinal anesthesia with mention of cerebrospinal fluid, injection of cocaine, and an appropriately short onset of action. And Henrik Quincke of Kiel, Germany, had described this technique of lumbar puncture property of baricity, and it was investigated by Barker, a London surgeon. In 1944, Edward Tuhey of the Mayo Clinic introduced two important modifications of continuous spinal techniques. Coming to the epidural anesthesia, caudal epidural analgesia is first described independently by doctors Jean and Fernand Catlin. Their innovations comes after an inadvertent epidural injection by Dr. Leonard Corning. In 1949, Dr. Martinez of Havana used Tuhey's needle and a urethral catheter to perform the first continuous epidural anesthetic. The neurologist Jean Athenes applied the technique for non-surgical purpose, that is the relief of back pain. Fernand Kathleen also used caudal anesthesia as a less dangerous alternative to spinal anesthesia for hernia repairs. He also demonstrated that epidural space terminated in the neck by injecting a solution of Indian ink into the caudal canal of a dog. The lumbar approach was first used solely for multiple paravertebral nerve blocks before the Page's Dogliotti single injection technique became accepted. And 10 years later, Achille Dogliotti of Turin, Italy, wrote a classic study that made the epidural technique well known later. In 1893, the London Society of Anaesthetists, the world's first anesthesia society, is formed in London, England. American Society of Anaesthetists was formed in 1936. Coming to the history of anesthesia in India, in 600 BC, it dates back to the era of Sushruta, a great surgeon of ancient India. He introduced anesthesia with opium, wine, and Indian hemp. In 1980 AD, Pandit Ballal, mentioned in both the Prabandh, Raja Bhoj underwent a cranial surgery under anesthetic influence of plant Sammohini, which was later reversed with Sanjeevan. 900 years later, ether was first used in March 22nd, 1847 in Calcutta under the supervision of surgeon Dr. O. Shaughnessy, and chloroform was used until 1928. In 1925, an interesting fact that Mahatma Gandhi underwent an emergency appendectomy at Sasun Hospital, Pune. During an electricity failure, Mahatma was administered open-drop chloroform anesthesia with surgery being completed by the light of kerosene and battery-operated torch. Until 30 years ago, anesthetic equipments in Indian operating rooms consisted of only simple anesthesia machine, suction unit, ECG monitor, and oxygen supply by cylinders. The idea of ISA was conceived in 1946 and it was formally established in 1947. The first ISA meeting 1949 during Surgeons Conference in Mumbai, and the first official journal was published in 1953, and the first independent ISA conference was held at Hyderabad in 1965. The first medical pipeline system was installed in Vellore in 1954, and the first ICU in 1963 in an army hospital in Delhi. The idea of diploma in anesthesia was introduced in 1946 in Mumbai University, whereas the post-graduation MD was introduced in 1955 in Darbhanga Medical College, Bihar. As we all know, due to the public demonstration of anesthesia by ether by Dr. Morton on 16th October 1846, 16th October is celebrated as the World Anesthesia Day. A quick note on an important anesthesiologist in the history of Indian anesthesia, Dr. Rupabai Fardunji. She is world's first qualified lady anesthetist, and she was a member of Hyderabad Chloroform Commission too. She later received part of her training in Edinburgh and worked as a full-time anesthesiologist at British Residency Hospital in Hyderabad. This is a picture of her with her colleagues. By virtue of by the virtue of their ability to administer emergency life support measures and perioperative management skills, anesthesiologists were at forefront in various calamities during the 2001 Gujarat earthquake rescue teams, tsunami disaster rescue teams, and in 2011 Mumbai and New Delhi bomb blast rescue teams. Thank you.
Hello, good morning, Shravani. It was a nice presentation.
Thank you, sir. Sir, thank you for giving me this opportunity.
Hello,
Omkar, Chapandi.
sir. As the topic is bit of dry, so we tried to add some pictures, some history, and some updates, so that to make it some bit interesting. So it's up to all the seniors. They should comment how was the class.
Class was good.
Thank you, sir.
Sir, any experience of using ether, sir? Ether, because we never have a chance to work.
I have used for around 8 patients. And it's not for using it, it's for only training purpose. Just want our HOD for us to know, that's all. Which was really, no, Shimel Mask was there, no?
Yes, sir.
We used to use that 8 layers of that and putting between the two and pouring the drops. It was really cumbersome. It's only for the purpose of training purpose. People, she was an old trainer, so she made us to do for some cases. But I feel
mostly work on halothane, sir.
ante. No, ఈతర ఉండింది కదా.
ఓకే సార్.
నార్మల్గా వాడకూడదు. We should not use it.
మాస్క్ అయితే ఆర్ఎంసీలో ఉంది సార్, యూజ్ చేయలేదు కానీ ఆర్ఎంసీలో చూసాం మాస్క్.
This
is actually history of anesthesia, my favorite topic. Actually ఇది డ్రై టాపిక్ కాదబ్బా, చాలా మంచి ఇంట్రెస్టింగ్ టాపిక్ ఇది, హిస్టరీ ఆఫ్ అనెస్థీషియా.
No, if anybody is interested in anesthesia, history becomes very interesting.
అసలు అనెస్థీషియా ప్యాషన్ తో జాయిన్ అయితే కనుక డెఫినెట్ గా హిస్టరీ ఆఫ్ అనెస్థీషియా ఇస్ ద మోస్ట్ fascinating subject actually. So how they discovered everything, a stories of history చాలా బాగుంటాయి. ఆ స్పైనల్ పంక్చర్, వాళ్ళు దే ఇంజెక్టెడ్ వన్ అనదర్, PDPH వచ్చి వాళ్ళు ఐ మీన్ లైక్ హెడేక్ తో 1 week హెడేక్ ఉంటే దే థాట్ ఆఫ్ యాజ్ హ్యాంగ్ ఓవర్. సో ఆల్ దీస్ స్టోరీస్ ద tragics అంటే WTG Morton is a success story, but behind that public success so many sad stories are there. One young fellow ఏదో చదివా కదా ఇప్పుడు నా ఫ్రెష్ గా, ఓంకర్, some fellow సూసైడ్ బాత్ టబ్ లో సూసైడ్ చేసుకుంటాడు కదా. సో ఆల్ హిస్ లైఫ్ లైక్ he discovered many things. Actually either కూడా actually he failed in a public demonstration prior to Morton. నేను మర్చిపోయాను, చాలా రోజులు అన్ని చదివి. బట్ అలాగా ఇట్స్ లైక్ వెరీ ఫ్యాసినేటింగ్ స్టోరీస్ అవన్నీ కూడా హిస్టరీలోనే. ఇప్పుడు ఏంటంటే ఇప్పుడు మనకేంటి 5 years బ్యాక్ కూడా హిస్టరీయే కదా, ఎవ్రీ 5 years ఇది హిస్టరీ నౌ. 5 years బ్యాక్ కి ఇప్పటికీ ప్రాక్టీస్ మారిపోయింది. మనం చేసే ప్రాక్టీస్ 5 years తర్వాత హిస్టరీ అయిపోతుంది డెఫినెట్ గా.
Hello, good morning. What are the components of modern anesthesia?
Sir, what was the question, sir?
What are the components of modern anesthesia? In olden days, ether anesthesia, there were 4 stages that were modified by some anesthetists. Modern father of modern anesthesia, he has given 4 components of anesthesia. What are those? Shravani, shall I tell you or you?
Sir, please tell, sir, please.
Analgesia, sedation, reflex suppression, muscle relaxation.
Okay.
So the
Sir,
most
what was the
notable
third one,
change
sir?
is amnesia. అంతేనా కదా సార్?
The
The notable change from the past definition is amnesia. Amnesia phase
amnesia is not analgesia, sedation, reflex
that
suppression, muscle
used to be
relaxation.
there no sir in earlier classification actually. Amnesia stage ఉండదు అనుకుంటా లేదా?
అక్కడ ఎగ్జైటేషన్ ఫేజ్ ఇంకా ఈథర్ స్టేజెస్ ఐ ఫర్గాట్ సంబడి ఎన్లైటన్స్.
ఈథర్ స్టేజెస్ లో amnesia స్టేజ్ ఆఫ్ amnesia analgesia అది ఉంటుంది కదా సార్. సో అది లేపేసినట్టున్నారు ఇప్పుడు మోడర్న్ దాంతో. బట్ ఈవెన్ విత్ మెడజలం వీటితో కూడా చిన్న amnesia ఉంటుంది కదా సార్ డెఫినెట్ గాను. యాంటిక్లైడ్ amnesia
ఉంటుంది సార్.
బట్ నైస్ ప్రెజెంటేషన్ శ్రావణి ఫర్ పోస్ట్ గ్రాడ్యుయేట్ డెఫినెట్లీ. నేను పీజీ ఫైనల్ ఇయర్ లో నేను ఈ క్లాస్ నాన్ అనస్థీషియా ఎంబీబీఎస్ స్టూడెంట్స్ ఒక క్లాస్ నాన్ అనస్థీషియా పోస్ట్ గ్రాడ్యుయేట్స్ ఒకసారి చెప్పాను ఇన్ ఫ్రంట్ ఆఫ్ ఎ ప్యాక్డ్ హౌస్. అందుకనే బాగా ఇష్టం ఈ టాపిక్ యాక్చువల్ గా. సో ఆల్మోస్ట్ లైక్ 150 మెంబర్స్ అలాగా 2 times చెప్పాను ఈ క్లాస్ పీజీ టైంలో.
సార్ ఇది అక్టోబర్ 16th యూజువల్ గా చెప్తారు హిస్టరీ.
అంటే అప్పుడు ఇంకా బాగా గొప్పగా చెప్పుకోవాలి కదా సార్. మంచి యాక్టివ్ గా ఎంతూజియాస్టిక్ గా చెప్పాను అనమాట. అప్పుడు ఇంకంటే పీపీటీలో కూడా కాకుండా మామూలుగా స్టోరీ టెల్లింగ్ లాగా చెప్పాను 2 సార్లు వితౌట్ పీపీటీ 2 సార్లు క్లాస్లో.
That's great.
థర్డ్ పీపీటీ చాలా కష్టం సార్. లాట్స్ ఆఫ్ నంబర్స్, లాట్స్ ఆఫ్ నేమ్స్.
పీపీటీ యాక్చువల్ గా టు కండెన్స్ ఇట్ ఇన్ పీపీటీ. నేను అందుకే నువ్వు పంపంగానే చాలా బాగుందని చెప్పాను పీపీటీ. వెరీ నైస్ యాక్చువల్లీ.
Congratulations and congratulations to Omkar. Hello.
ఏంటమ్మా విష్ణు భట్లకి
Thank you,
కదా
madam.
చెప్పాలి, ఓంకార్ చెప్తావేంటి?
And one more thing, that scientist expert, no, that is nitric oxide, nitrous oxide experiment. So he succeeded one experiment, but in other patient he failed, so he suicided.
Demonstration says, madam, Humphrey Horace Wells sir, and he left hand cut చేసుకుంటాడు.
బాత్ టబ్ లో దట్ ఫేమస్ ఫోటోగ్రాఫ్ will be there. బాత్ టబ్ లో suicide photo.
He'll stop
Good morning,
practicing
sir.
anesthesia. He'll be roaming.
Good morning, sir. Sir, I'm Dr. Shakuntala, sir. Hello.
Shakuntala, yeah, audible.
Good morning, sir. Sir, Horace Wells committed suicide in jail, sir. He was kept in prison for throwing acid on prostitutes, sir. So he was kept in jail, and even in jail, he used to do certain by then only he used to do experiments on another drug, sir, and he injected the drug in his femoral artery in jail, sir, and that is how he committed suicide.
పార్క్ లో కూర్చొని హ్యాండ్ కట్ చేసుకుంటారు, అదెవరు మేడం? కంప్లీట్
రీసెర్చ్ గ్రూప్ లో పెట్టి.
And when Morton has demonstrated this, on World Anesthesia Day, when he demonstrated ether, even Horace Wells and one more scientist from another country, both of them didn't allow the then constitution to give the credit to Morton, sir, because they claimed that they were the ones who first introduced anesthesia. And another reason also was given for failure of nitrous oxide demonstration by Horace Wells, sir. Horace Wells demonstrated for tooth extraction, but that patient, due to anxiety, though he didn't experience pain, he shouted pain. And also one more scientific reason they have given, sir, I forgot the reason. And that's why his experiment failed and everyone called him a scumbag.
So
What
that is the
about
reason
laughing
Naveen
gas?
says.
Sir?
That is the
Laughing
reason
gas.
Naveen has put the message that whoever has done something, you should publish it.
Nitrous oxide actually was used in then centuries as an entertainment purpose, sir. They used to demonstrate, people used to pay a little bit and inhale the nitrous oxide, and whatever entertainment they give, like, in that trance, they used to dance and all. That used to be performed on stage. It is during that performance, Horace Wells once sees that performance on stage and he gets impressed with that nitrous oxide thing. And when one of the performers injured his legs and he won't experience pain, then the thought of analgesic property of nitrous oxide strikes to Horace Wells. So that day evening only, he goes and collects that gas from the chemist called Colton, I remember. And he himself inhales the nitrous oxide and gets his tooth extracted. So he won't experience any pain. He demonstrates it on another few patients and then gets ready to demonstrate it in public, but the experiment failed.
And Priestley?
Sir?
Who is Priestley? Joseph Priestley.
Joseph Priestley, he discovered nitrous oxide in air, sir. Oxygen and in air, I guess. That's it, only that much I know about him.
So, in history of anesthesia, Horace Wells and nitrous oxide should also be included, I think.
So I was given a seminar on nitrous oxide, sir. For the first time when I read about the history of nitrous oxide and Horace Wells, I was really not recognized and all, how he got into history of anesthesia.
Hello, Shakuntala madam.
Sir, good morning, sir. Chappan, sir.
Good comment on history. You proved why you got university second. Congratulations.
Sir, I don't know, sir. Under the marks tell you, sir. Only a few people I know, and
అందుకే ఓంకార్
Sir.
నార్మల్ గా పీపుల్ టాక్ ఫ్రీలీ యాజ్ ఎ మేల్స్ అండ్ ఫిమేల్స్ యాక్చువల్లీ if there are 40,000 words known to female, they'll talk, and only 20,000 words knows males will talk. So that's why they're better.
Sir, first time I'm hearing it the other way around. Actually, you put it in a better way, sir. They say female knows only 10 words, but she adds another 90 words and talks to 10 people. But you put it in another way.
Oh, no. Monzar is the better person to comment on that.
Sir, actually, history of anesthesia, when I read it for my theory examinations, it was really, actually, I felt, why didn't I read all these days? It is very much involving and it gives lots of surprises, sir. Succinylcholine was introduced, I remember the scientist, but he is a very mischief student during his education. He himself got injected with succinylcholine. And by luckily, he could give a signal to his assistant, who is also present during that experiment, his friend. He could say, put a mask over him. Oxygen supplementation was given and then he survived. And he was excluded from the he was suspended from the course for this thing. And later on, again, experiments were done on succinylcholine. And even August Baer, when he introduced spinal anesthesia, Coring have come and he claimed that he has first introduced spinal anesthesia, but the effect was not done. Coring actually introduced this into the epidural space. And therefore, spinal anesthesia was first introduced by August Baer, and Coring did epidural anesthesia. He was given the credit for epidural anesthesia. August Baer also conducted asked his assistant to conduct spinal anesthesia over him, but after a number of pokes by his assistant also, he couldn't get the effect. But that same day evening, he again made the assistant be the experimental study, and he gave spinal anesthesia to his assistant, and he tortured him below the umbilicus. And finally, they celebrated in the evening that they have discovered spinal anesthesia. All these stories are really very, fascinating, sir. It's like a storybook. Hello?
Yeah, true, madam, true.
Hello, madam.
Sir.
ఏంటి మేడం హిస్టరీని కూడా పిండి పిప్పి చేశారుగా.
మర్చిపోయాను సార్, పేర్లు అవి ఏమి గుర్తులేవు. యాక్చువల్లీ మై మైక్రోఫోన్ వాజ్ నాట్ యాక్సెసిబుల్. మోడర్న్ ఎనస్థీషియా కాంపోనెంట్స్ అది చెప్దామంటే till now it didn't get accessed.
You please, now you can tell, madam, what is the difference between the modern anesthesia and the old anesthesia?
Sir, I know only 2 points, sir. That day, in the past days, they used to grade anesthesia by ether stages, and stage 3 was called as stage of anesthesia, and stage 4 is stage of death. And the modern anesthesia comprises of, as sir earlier said, analgesia, amnesia, areflexia, and I forgot the fourth component, relaxation, muscle paralysis. These 4 things compromise modern anesthesia, sir.
Who is the scientist who coined modern components of modern anesthesia? I forgot.
Sir, I don't know, sir. And some of them are still alive and they are going on. The one who introduced the supraglottic airway devices, all the 13 generations, he only, it's not that he introduced one and someone else improved the other, improvement of that one. But it is still the same person who gave all the 13 generations of supraglottic airway devices, and he's still alive. I forgot the name who introduced supraglottic airway devices.
Tohi epidural Tohi contribution.
Sir, caudal, I guess, sir, caudal epidural contribution.
The epidural needle is tip is curved. That is Tohi's epidural needle. And
sorry. Yes, sir.
Markings are there on the epidural needle. It is Lee.
Okay.
I think in the Lee textbook last, they give a lot of history compared to other books, no?
Sir, whatever I learned from the Google only, sir. It gives like a story thing. I didn't read any book, but all the information I got only from Google, sir.
Is it true that the Lee textbook has a maximum history compared to other books?
Sir, I didn't go through Lee, sir, so I don't know, sir.
Very interesting, Dr. Vishnu Bhatla. And anyway, I think moderator, we can change it from Omkar to Shakuntala. What do you say, Omkar?
Sir, I'm also his student only, sir. He only should be the moderator, sir.
Srikanth, thank you.
Actually, history and Miller, sir. Miller lo manchi.
I also think Miller has given maximum.
Miller standard.
So when I was a student, our standard book was Wiley to our level. It was Miller was for reference book.
Wiley physiology చదివేవాళ్ళం సార్ మేము. రెస్పిరేటరీ ఫిజియాలజీ అంతా వైలీ చదివేవాళ్ళం. మిల్లర్ ఇప్పుడు ఇదిగోండి స్టూడెంట్స్ అందరూ హ్యాపీగా గూగుల్ తల్లి అంత ఫెసిలిటీస్ ఓకే.
Any seniors, Anuradha, Rani, anything? Your juniors, your freshers, passing all level lera? Can we have a close? Manjula is there?
I think it's 9, sir. Everybody is running behind cases.
Yeah, understand. Thank you.
Babu, Kiran, next week neither class topic speaker. Kiran is there. Raja.